The most powerful tool that you have is your voice. And your ability to use your voice to share your stories, open up about breaks in the system, and continue to move toward a stronger tomorrow is a superpower. Welcome to Normalize the Conversation. I'm your host, Francesca Reicherter, and today I'm joined by a UK-based NHS doctor, Dr. Ali Jaffee. Join us as Dr. Jaffee talks about the importance of human stories and mental health, as well as her life as a junior doctor.
I am so excited for our conversation, but before we jump in, I really just want to check in with you. How are you really?
So thanks for asking. And I think it's so important that you ask this question. And there's been a lot of campaigns in the UK recently, especially with men's mental health, making sure you ask your friends and your colleagues and those close to you, how are you really? And that double asking, because we know that when, especially us Brits and in the UK, when you say, how are you? People usually say, oh, I'm fine. And then you move on. So yeah, appreciate the how are you really question. I'd say I'm really good overall, but I'd also say that I'm definitely a work in progress and I'm still working on certain things to optimize my well-being and mental health. And I feel like at the moment it's been quite a crazy start to the year and I'm almost chasing my tail a little bit too much and needing to strike that balance again between making sure I dedicate time to myself and to my loved ones, as well as, committing to things I'm passionate about and just finding that fine balance of not overcommitting. So that's, I'd say that's where I'm at the moment. How are you?
I really resonate with what you said, and that's kind of where I'm at too, is trying to find some kind of balance. I like to make 2,000 commitments a day. My schedule is always so packed, and I'm like, I can handle all of this. No. And it's so difficult to learn when I have to say no and accept that, like, sometimes different roles have different priorities. I'm a student and then a nonprofit owner, a podcast host, a writer, caretaker, and it's just trying to balance all of that can feel so overwhelming. So I don't love that you feel that way too, but I love that someone resonates with that.
Yeah, I mean, I guess a big realization I had a few years back is when I was a medical student, I realized that actually burnout is not what I thought it was. I thought burnout always was when people who hate their jobs talk about how uninspired they are, but how they feel trapped because they need it for, financial security. And so people who get burnt out are people who aren't in a vocation. There are people who are working for purely financial means to make a living and support their families, etc. I never realized you could burn out from being passionate about what you do. And that was kind of where I got to. I overcommitted myself and I said yes to too many things and said no to myself, which really got me in a sticky situation. And I think since then I've been recalibrating, but knowing that, it's still always looming. I'm a very passionate person, and it sounds like you are too. And you want to say yes to so many things, and you have to really pull back and say, what's important to me, what matters to me right now, and be selective. And it's such a challenge.
It is. I feel that same way. I thought when you were there's that quote that's like, if you do something that you love, you're never going to work a day in your life. So I thought that that's kind of how it would be, like being so passionate, loving what I do, being so excited and grateful every day would never lead to a point of complete exhaustion and feeling overwhelmed and not knowing what to do. And when I get to that point, my mental health just completely crashes and I get so even more frustrated and overwhelmed because, like I said, like you said, like you never realize that having so much passion and loving what you do can feel exhausting.
Completely that. And I just have to catch myself and just realize that Rome wasn't built overnight, and I consider myself to be a young change maker and really wanting to, like you, inspire my generation. I'm 27 and I'm a medical doctor as well as a startup founder of a nutrition and lifestyle medicine startup. And I have a mental health advocacy and content platform. So do a fair bit, and I'm passionate about it all, and I want to train and specialize as a psychiatrist. And I think for me it's just realizing that you have phases in your life and you can't there's so much I want to do, there's so much I want to achieve, there's so much I want to experience, but you have to slow down and realize you can do it in different phases. It doesn't all need to be done at once, because then you need to be there, you need to be able to get there and not burn out before then.
Absolutely. And just doing it in phases and knowing that that's okay. Like, you can't tackle the whole staircase in one day, and that's fine. Like, that's not being like lazy or not caring enough or not trying hard enough. All those words, unmotivated, all those words and adjectives we like to throw around and criticize ourselves with. It's okay to not be able to do it all. And it's okay if someone else is able to handle more than you can at that moment, because your situation is completely different. Everyone's their own person. Everyone has their own life that people may not even see what's behind closed doors. So recognizing that just because someone else is posting on social media that they are doing 2,000 things doesn't mean that you have to be able to do it as well.
And I completely agree with that. And it's all about, and when I speak to my patients and I'm talking about behavior change and motivational interviewing, it's all about meeting the person where they're at and within their current biopsychosocial context. And I think when I see influencers and people who have certain, reputations in the media, whatever, saying that we all have the same 24 hours in the day, I think it's quite short-sighted and pretty offensive to the general population, because most definitely people do not have the same 24 hours in a day. And it just, that comes obviously from a huge place of privilege to say that. So I definitely think it's just about being true to yourself and doing what you can when you can. And yeah, I'm still learning to do that.
I love that you brought up the 24 hours, because I was just talking about this the other day with someone. I was like, no, I get that we both have 24 hours in a day. Like, I am not arguing that point. We have 24 hours, but your 24 hours and my 24 hours are very different. How it's distributed and split up is very different, and that's okay. There's nothing wrong with that. But how much you're able to do, or how much free time you have, or how much money you can make versus me is going to be different. And we're not on the same playing field all the time. It's not equal, it's different, and that's okay. But comparing my 24 hours to your 24 hours it's not the same. I agree there's 24 hours, but it's distributed differently for all of us.
Absolutely. Like, we're all unique. We've all got our own stresses, there's socioeconomic factors, and so much more. It's a ridiculous statement.
It is. And I think that it really can contribute to a decline in mental health when you're constantly comparing yourself and you constantly feel like you need to compare yourself because of the messaging that you're hearing. And when someone has a big platform and they're talking about how much they can do and you need to work harder too, it can feel very debilitating. Absolutely. I don't have the words to really explain how hard it is when you're constantly comparing yourself and you see they can do it, why can't I, and beating down on yourself. And when you get into that cycle, it's so hard to come out of it and be able to be as productive in what you do and how you want to do it, because you are struggling.
Absolutely. And I think it just comes down to how we choose to live our life and what content we choose to consume. and what relationships we choose to keep and all of that. And I think being in my late 20s now, I've really got to grips with, still getting to grips, but got to grips with working on just drowning out the noise and learning more and more about just tuning in with myself and trying to be a better version of me than trying to be, as you know, just even beginning to compare myself to anyone else. And I remember, I guess it started, I'd say at school I wasn't super competitive. Never would describe myself as that, but I was always driven on my own, at high school, on my own mission to get into medical school. So I didn't get in first time round, and it was frustrating when some of my classmates did, but I just kind of thought, you know, it's my own life, it's my own journey. It doesn't matter that they got in, I just need to try again. And then I remember at medical school, when it came to, like, you know, you're with all these brilliant people because it's so competitive to get in, and you realize that actually we all work in different ways. And I remember I got to the stage where it just didn't suit me to go and study with friends and study in groups, because if they understood a concept faster than me and we did a mock, you know, a thing together, and they scored higher than me or whatever, it just wouldn't help me. So that's when I really kind of became, I'd say I became like the own captain of my ship, and had agency to just learn what my needs are and study by myself. And that's when I did like the best work and had the most amount of flow state and just really being able to focus. And then fast forward to now as a professional, and bringing into like my own personal brand and social media, I really try and focus on only following and consuming content that is authentic and meaningful and aligns with my foundational values of connection and kindness and compassion, because there are so many people on social media platforms who will just show you the highlight reels and not be real, and not actually tell you about the failures and the struggles that took place to get there. So if you were to literally just take me on paper, you'd say, you know, I've won 3 national awards. I've got a pretty well-known startup for social impact, and I'm a medical doctor, and you know, done a lot of press and media here and there, whatever. But then actually, if you just unpick the layers and you start tearing them away, and you actually read my content, which I try and make as authentic as possible, you'll learn that there's been so much endless struggles and failures, if you want to call them that, along the way. And I just think that not everyone, you know, everyone can create their content in the way they want to. We're not in like a totalitarian state of this is how you should post. But I think that a lot of people will just show you the highlight reels, and you won't understand what the journey they went on to get to that outcome and end result. And you'll find yourself just getting very outcome oriented and obsessed. And I guess for me, something I've really tried hard to work on is to not have conditional thinking, and to just really try and have intrinsic motivation, so doing things for myself rather than for extrinsic reasons of, you know, clout and external validation. Not to say that I always can stick to this, but I try. And I think when I do find myself doing things for myself, it's far more fulfilling than, oh, I need to do this because they're doing it and I've seen that they've been on that podcast or they've been on this and blah 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 blah. So yeah, I think it is really tricky with how social media is set up, and especially for young people who don't see the nuance and they don't see the gray areas, and they just see like this is the good life, and they're like, well, how do I get there?
Yes, exactly. And I mean, to me, it's so important to be authentic in everything. And it seems like that's the way it is for you, and being transparent that it's not always easy. And that's okay. Because I mean, I like to post it on social media because hopefully it'll help someone else, but it's also a reminder for me. Like, it really is that what I've been going through, it has been difficult sometimes. I've gone through a lot of stuff, and I'm always working on myself. I'm always trying to grow. I'm always trying to change for the better. But sometimes it's not easy and it's overwhelming and I just can't do it. And I mess up, make mistakes, fall apart, and all of that's okay. And when we don't have those conversations or have those reminders in place for people, it's how are they supposed to know? How are kids supposed to know when we're not having conversations like this in a manner that they will hear and that they'll listen to and be able to actually absorb the information? Because when you're following all these accounts that are highlight reels, like you said, that's what you're consuming all day. That's the messaging you're getting all day. And then suddenly you're in your own life and you're like, why am I not there?
Yeah, no, I absolutely agree with that. And I guess it is just important to get that to kids quite early on. Like I didn't have TikTok and Snapchat and all of that growing up. So, I remember I obviously had a smartphone when I was a teenager at school, but I can't even, but besides like Blackberries and BBM and things like that, when I was growing up, it wasn't the be all and end all as social media is now. So I can't imagine how all consuming it is and like where their identities come from and kind of false perceptions that they may get.
The world is so different today. I was growing up when social media was kind of starting, and so I'm 24. So I was growing up with, I think iPhones came out when I was in like middle school, maybe. And the world was changing slowly. And we were kind of like in the beginning of it and getting to see it. But people growing up today whose whole life is kind of been centered around it can be really difficult. And if we're not being careful with what content we're putting out there, I feel like we really can influence someone's mind. We can influence no matter how old you are, especially kids whose brains are sponges. We're influencing every piece. So with that in mind, how do you come up with what content you want to put out there?
So yeah, I think that's a great question. And I actually recently had a similar question. I was speaking on a mental health panel at the YouTube UK health event, and we were talking about exactly this. How do you come up with content? And I guess the reason why it's such an important question is because I'm coming from it as I'm a medical doctor. So the content I come up with has to be really well thought out, and it has to be with caution, because my content reflects my own views and not the views of my organization. And I also ensure that when I am producing content about difficult issues to do with mental health, mental illness, that I put trigger warnings and disclaimers and also signposting. And those are the key things that inform my content, because I often want to talk about an interesting mental health documentary I've watched, or book or story I've heard about someone who's struggled with severe mental illness. But and I'm also passionate about talking about suicide prevention. But I know that you have to really be careful online and make sure that if you are bringing up something difficult, that you're also offering support, but it's not medical support. It's never to replace medical advice from your own practitioner, but it's to make sure that people know that there's support out there. So that informs a lot of my content. And then how I create it and ideas that I come up with is mainly about my own experience and my own interests and passions. And I try and do a fair bit of psychoeducation as well. So really breaking down in a simplified way topics to do with mental health and psychiatry, and making it intelligible for the lay public, essentially. So I talk a lot about my own lived experience with depression, as halfway through medical school I fell into clinical depression, and I talk a lot about the stigma that there takes place with doctors' mental health and people in the healthcare profession coming forward. And I talk a lot about holistic interventions to better our mental health, but making sure that we don't stigmatize pharmacological interventions as well, because I think that's what also happens with social media, that you get very polarizing views and no nuance and gray areas. So a big important thing for me with my posting is that my captions are super long. Some people I know probably don't read them, and that's absolutely fine. But the reason why I want my captions to be long is because I really want them to capture the nuance, because there is so much that gets lost in translation when you see clickbait press articles, and when you're not reading from evidence-based scientific journals and all that jazz, and just reading from social media accounts about really serious topics. So I really do try and break things down around all things mental health and life as a doctor.
I really appreciate the amount of effort and caution you put into everything you put out, because like you said, it can be very dangerous to be posting unfactual information, and it can just be very difficult when someone doesn't know what to do, when they don't know that support is out there, or they think that DMing someone on Instagram is the same as therapy or having treatment by a professional. So by not clarifying, by not taking the time to make sure your information is accurate and it's offering some kind of support or resource, it really can impact someone. You don't know how the person who's consuming it is feeling. You don't know what they're going through. So being so mindful is really important. And I appreciate that you do that, because like you said, there's so many polarizing views. And when we're not paying attention and we're consuming too much of one, it can really stigmatize the other.
Yeah, I couldn't agree more with that. And I think that's something I stand by. And like the main thing that informs my content is I just try and tell my story in chunks and as I go along. So my audience is coming along on that journey with me. And if something's gone wrong, depending on what it is, because I also put boundaries in place for myself around not feeling the need to post. But if I do feel like something's gone wrong and I've made a mistake, or I've had a huge learning point and I feel comfortable enough and ready to share it, I'm happy to do so. I'm an open person, but it's all about timing and when things are right. And I guess what I just want to pick up on what you've just mentioned is having that in the middle area and finding nuance in between these polarizing views. And something I try and say is I'm really passionate about holistic mental health. That's kind of, what I'm building my brand upon, and the kind of psychiatrist I want to be, or shrink, I should say. I want to be able to really empower the person to have tools within their lifestyle and their everyday life that they can use and act on to better their mental health. But at the same time, I'm actually completely pro medication and evidence-based use of medication, because in crisis you so often need to use it. And I am still on antidepressants 4 years later from when I fell unwell, and for me that's not really an issue. I'm going to come off them in the near future when I feel ready, but I also practice a lot of these other holistic things in my life. And so it just shows that you don't have to pick Eastern or Western medicine. You don't have to pick one or the other. You can merge them together, and that is essentially whole person care, which is how I'd like to practice medicine.
Absolutely. And I love that. That's something I'm really passionate about too, is giving people the tools that they need and can cope in everyday life, can manage their stress, can manage what they're going through, can create boundaries for themselves, can do all these things that they need to do for themselves and by themselves. However, also a huge advocate for medication when it's appropriate and needed. I'm a huge advocate for going to a mental health professional, but also being willing to go to like acupuncture or massage therapy or a chiropractor, because they can all have great benefits for your mental health too. So I think that's just finding what combination works best for you. For everyone, it's so different. And that's okay. There's not one right answer. It's not Eastern or Western, or maybe one works better for you and that's where you're comfortable with, and that's completely fine. But I think that having that combination can be very, very beneficial, and building that combination around your current circumstances and life situation.
Yeah, no, I totally agree with that. And I think it's so important that we move towards a more personalized medicine approach. And that is what is starting to happen, but it's very hard to scale that. So it will be a long time before it's completely mainstream. And at the moment, personalized medicine is very commercial. And if you have the money to pay for it, you can go for all those very thorough assessments and have all the, varied professionals helping you. But I think that is where we're moving. And what we've realized is, especially in psychiatry, it's such an art, and it's the perfect mixture of art and science, but really it's such an art because so much is individual, and just because it's worked for someone, it doesn't mean it works for someone else. And there just isn't this one size fits all approach where if you have appendicitis, you're going to take out the person's appendix, done, dusted, and other kind of examples within other specialties in healthcare. Psychiatry really lends itself to being about that person sat in front of you and realizing what's their cultural background, what's their social economic context, what is it that actually matters to them, rather than giving your opinion and being paternalistic, reaching that shared decision. And I'm excited to see where, the future of mental health is going to go. And even with things like medication, we know that it's not a one size fits all either. And there's more and more going into an area called pharmacogenetics, where they're realizing that certain medications work better on people with certain genetic predispositions. And so actually, to have the ultimate personalized medicine approach, we need to be doing genetic testing on people before we prescribe strong psychiatric meds, so we know that they actually will work with that person and it will be effective, rather than being ineffective and that person getting side effects too. But sadly, yeah, we're still a far way off where that becomes scalable and for the masses. But I'm really excited to see, where the schools of thoughts are heading.
I am too. I recently took multicultural counseling, and that's kind of what we focused on, is paying attention to someone's different backgrounds, their culture, socioeconomic status, and what their family dynamics are. Looking at the amount of conversation they've had around mental health, looking at the different roles that they play in their life, and be able to actually look at them as a person and not just based on what the textbook tells you to do. Because although the textbooks have great intention and they can be very, very helpful and useful resources, sometimes they're very limited in not paying attention to the person as an individual. It often can be very commercialized, kind of like you said. So paying attention to all the different factors influencing someone, influencing what they can and can't do. Like you said, medication. Someone reached out to me on Instagram lately and said medication is no longer being covered by insurance, and she doesn't know what to do because she doesn't know how to cope with anything she's going through. She doesn't have any coping skills. And for me, that was huge to hear someone say, oh, I've been on medication this whole time, but I've never started to gather the tools that I need to get through. So making sure we're giving people both ends is also really important, because you never know when insurance is going to be like, we're not covering that anymore, and it's now $1,000 for 30 days of medication.
Gosh, that is such a terrible plight. And one of the things that I find so painful about the healthcare system in the States, hearing people run out of insulin and all the essential drugs for chronic conditions, it's truly devastating. Obviously, we're in a very different situation here in the UK because we've got a socialist healthcare system, the National Healthcare System, the NHS, which unfortunately is really fractured at the moment, and their junior doctor strikes next month because we get paid so abysmally, and we're so understaffed. There are a whole host of other issues, which for a whole other podcast. But I think that is such an important point, and obviously the pressure of the financial situation is why this has come to light. But it shouldn't be that it's the finances that are influencing this person needing to learn new coping skills because they'll no longer be the medication. It should be a judicious process that when a medical practitioner is prescribing someone something with informed consent, telling them what the medication does, what the side effects are, they're also saying, and it will be useful to refer you to therapy services or group activities in the community, blah, blah, blah. Unfortunately, in the UK, this is where I would like it to be, but the reason why that doesn't happen, and often the pharmacological intervention, the quick prescription, the quick fix is what happens, is because of funding and the fact that social care and community care is so underfunded, overstretched. People in the UK are on young people, which is where my passion lies. They're on the list for talking therapy for like 8 to 9 months plus until they can see a psychologist. And so obviously it's the systemic issue, and it's never really the individual. In some cases maybe it is the individual, actually, when they just don't have the education around the importance of these non-pharmacological interventions. But a lot of the time it's the system error that there just isn't enough time in the consultation, so medication seems like the easiest thing to give, and there's not enough training for practitioners to be like, well, we, the movement of social prescription, and well, we know that green therapy and gardening and cooking and all these things that you can do mindfully, and music therapy and blah blah blah, these things have benefits, but and exercising, etc. But because so much of a medical degree is focused on pharmacology, and big pharma is also what influences the profession once you qualify, it's a really tricky environment to practice in. It's so multifactorial.
It really is, and it's really just heartbreaking to see how much the healthcare system around the world, I mean, it's so different in so many different areas and countries, and yet it's still so broken everywhere. It's genuinely so broken, and it's so unfair that we live in a society where mental health is often stigmatized and not talked about enough. A lot of misinformation goes out there via social media and irresponsible posting, and then it taking 6 to 9 months just to get to therapy.
Yeah, because in the UK it's a free healthcare system, so that's why, essentially, because if you were to self-fund it, obviously you could probably be seen sooner, but everyone is coming from a different socioeconomic background, and that's because it's a national healthcare system. That's why the waiting lists are crazy, because there's so many people to serve and not enough resources and not enough funding. So yeah, it's a bit of a mess, and mental health is often just the Cinderella in healthcare systems because there is no quick fix. So infectious disease and all of that gets so much more funding, diabetes, etc. And mental health, which affects 1 in 4 adults, mental illness affects 1 in 4 adults. Yeah.
It's such a shame to see how little funding. I mean, you would think as a society, as a world, we've come so far in terms of mental health and having these conversations, and yet the funding has just not come very far at all.
Yeah, I strangely hold hope, and we are seeing loads of innovations, like things for me that I'm excited about that we're seeing in mental health is things like psychedelic treatment and new modes of therapy, nutrition and lifestyle, and the powerful research papers that are coming forward now to show what we can do when we educate people around that. So yeah, I don't know, it is bleak, but I try and keep positive about what the future innovations hold, and hopefully more and more impact will be made, and more funding and exposure.
I hope so. As we're wrapping up, do you have any advice for someone who maybe can't access talk therapy right now, they can't access medication, and they just need some kind of support?
I guess reading and really absorbing a lot of good information from healthcare professionals in the books that they've written. And some of them are even on TikTok and Instagram and make it really tangible. I guess that is never a replacement for one-to-one therapy or, really seeking medical advice if you're in crisis. But there's so many brilliant books out there written by psychologists and psychiatrists now, and programs you can follow and tips that you can learn about reframing your thoughts and really being able to understand the type of thinking you possess, whether that's the kind of doom or gloom, black or white thinking, and minimization, when you think that your problem is insignificant, so you're not going to ask for help, and catastrophizing, and all these different thought distortion patterns. And I guess books that I could recommend, there's this brilliant one called The Mental Health Workout. It's a mental fitness book written by a British psychologist called Zoe Ashton, and she frames it around like going to the gym, mental fitness, and she takes you through like all these different conditionings and really good program. And I'd recommend Dr. Julie Smith, a British psychologist as well, who's written Why Has Nobody Told Me This Before? And it's really epic.
Dr. Ali Jaffee, you've been absolutely amazing. Thank you so much for joining me today.
You're so welcome. Thanks, everyone. And if you check out my social handles, which are at Dr. Ali Jaffee on Instagram, LinkedIn, Twitter, and my website's www.dralijaffee.com. Thanks for having me.
Thank you so much for listening to Normalize the Conversation. Don't forget to subscribe, rate, and review. This podcast is an initiative of Inspiring My Generation, focusing on normalizing the conversation, bringing education and awareness to the forefront, and amplifying global voices to spark change and hope. Inspiring My Generation is a 501c3 nonprofit organization on a mission towards suicide prevention through awareness, conversation, education, and support. Connect with us on Instagram at Inspiring My Generation and visit our website inspiringmygeneration.org to learn more about our work and how you can make a difference.